How many times have you been asked, do you have a full set of vitals? But the real question is, do we need a full set for every single patient no matter what? Today on EMS MythBusters, we're tackling the myth that vitals are always the most important part of patient care, and whether it's time to stop chasing numbers and start prioritizing clinical context. Here's the myth. You're not doing your job unless you get a full set of vitals. Blood pressure, pulse, respirations, O2 sat, maybe even a temperature on every patient, every time. But is that true for a patient vomiting blood at 3 a.m., the combative psych patient screaming in restraints? Let's take a closer look. Vitals are important, but they are a tool, not the priority in every case. EMS cares about scene safety, clinical presentation, and decision-making under pressure. And sometimes that means treating based on the story, not the monitor. And what about pediatrics? Try taking the blood pressure on a screaming 2-year-old. It'll be inaccurate and unnecessary if they're clearly stable, alert, and pink. Remember, it's not no vitals ever. It's about delayed or selective vitals based on clinical priority. I've had nurses say, I need all the vitals before I take report. And I get it, but sometimes there's no time, or the environment doesn't allow for it. In those moments, explain what you prioritized, what the barriers were, and what you did instead. We're clinicians, not clipboard robots. So are vitals always vital? No, vitals are a tool, not the point. Use your judgment, focus on your patient, and document the why when you delay or skip doing vitals. Drop a comment if you've ever been chewed out for not getting a blood pressure on a combative trauma patient mid-airway attempt. We've all been there. Like, subscribe, and follow for more EMS truth bombs. This is EMS MythBusters, and I'll see you in the next one.